Hi, everyone. Welcome. Thank you for joining today's webinar, Clean Energy and Climate Solutions, Health Sector and Nursing Leadership. My name is Kara Cook, and I'm the Climate Change Program Coordinator for the Alliance of Nurses for Healthy Environments. Annie is proud to host this webinar with Climate for Health, a program of Eco America. From more extreme heat days to air and water quality impacts to more intense extreme weather events, climate change poses significant risk to human health. There's an urgent need for strong climate change strategies and interventions that protect the public's health. And nurses in the health sector play a critical role in helping to move those solutions forward. Today's webinar will provide a brief overview of how our energy choices impact human health and the benefits of transitioning to 100% clean energy. In addition, our presenters will share examples of how organizations and nurses can support a transition to clean energy. Before we get started, I have a few housekeeping items. We will take questions at the end of the presentation. You can enter a question during or after the presentation by entering it into the chat box in the bottom left-hand corner of the screen. The webinar is being recorded, and the link will be sent out to those who registered for the webinar. In that email, we will also send a link to complete an evaluation and post-test so that nurses can receive 1 hour of continuing education credit. Annie's work in climate change is focused on elevating climate and health as a national health priority by engaging nursing organizations and individual nurses in climate and health advocacy, education, and practice change. Through our partnership with Climate for Health, Annie has been able to expand our efforts to educate nurses on the health impacts of climate change and to engage nurses in climate solutions. We hosted the first climate change conference bringing nurses together in 2016 and have developed various nurse-specific resources, such as a Getting Started Guide for Nurses, a Climate and Clean Energy fact sheet, and a Caring for Climate and Health video. These resources are all available on the Annie website, and we encourage you to check them out. Now I'd like to turn it over to Layla McCurdy, Director of Climate for Health, to provide a brief overview of Climate for Health and our partnership.
Thank you, Kara. My name is Layla McCurdy, and I'm the Director for Climate for Health program. And with me here is Rebecca Rear, who's the Program Manager for the Climate for Health program. And she will be talking to you later. I will just give an introduction to Eco America and Climate for Health. Just want to say to start with, we are delighted to be partnering with Annie on climate solutions. And let me just start with a brief overview of Eco America, which is a nonprofit dedicated to advancing solutions for climate change. We build institutional leadership, public support, and political will for climate solutions in the U.S. We help national organizations elevate their climate leadership by providing them strategy, tools, and resources in order to demonstrate visible climate leadership, to empower climate literacy, to engage all constituents, and build collective action and advocacy. The Climate for Health program, which myself and Rebecca lead, is under the umbrella of Eco America, which works specifically in 3 sectors. Climate for Health is being one, working with leaders in the health community. So it is a national initiative. It is led by a diverse network of leaders from across the health sector. They represent key healthcare, public health, clinical, and medical institutions and associations. Collectively, we are committed to advancing climate solutions to protect the health and well-being of Americans. And we offer support, inspiration, and resources to new leaders ready to make their own commitments and build support for climate solutions. Here you see several tools and resources that we provide to our partners. On the left-hand side, you see that there are a couple of talking points. These are just examples of our biweekly talking points that we release to all of our partners. Recent ones were focused on clean energy and children's health. And on the right-hand side, you see some of the reports. Again, we are happy to share with all our partners. One of them is the mental health report, which we have developed with the American Psychological Association, and the other one you see that is extremely helpful for all our partners is Let's Talk Health and Climate. It's a communications guide to talk to health partners about climate change and engage them in this issue. These are all available on our website, and please check our website, which will be displayed later during the presentation. And as mentioned earlier, we are very happy to be working with Annie, and together we have created the Nursing Collaborative on Climate Change. And as you well know, nurses are the most trusted health professionals, and their involvement in the climate change issue goes a long way. We provide all the tools and resources I mentioned earlier to all our nursing partners, as well as we have created several together with Annie, which Kara mentioned, and one is displayed here. We are happy today to have 8 organizational members of the Nursing Collaborative, and it is growing exponentially. At this moment, I would like to turn it over back to Kara to introduce the next speaker. Thank you very much.
Thank you, Layla, for that great overview. Now I'd like to introduce our first speaker, Dr. Beth Schenk. Beth is a nurse scientist for Providence St. Joseph Health and sustainability leader at St. Patrick Hospital in Missoula, Montana, as well as across the 50 hospital system. She is also an assistant research professor at Washington State University College of Nursing. I'll turn it over to you, Beth.
Thank you, Kara, and thank you all for joining us today. I'm happy to be with you. I'm just going to talk a little bit about what are some solutions that nurses can contribute to regarding climate change. So first, a little bit of background about health impacts of fossil fuels in general, and much of this you all as nurses who are on the call will already know. If we think about coal, which is one of our primary drivers of energy in our electricity sector in the U.S., just the burning of it, the top half of this slide, creates a number of air pollutants, carbon monoxide, sulfur dioxide, trioxides, et cetera, the nitrous oxides, particulate matter. And these contribute to known health problems, including these listed on the right, from skin to cancer. This has been known for a long time, and this is one of the reasons we have a Clean Air Act, and we have done a fair amount to clean that up. However, it persists. We're still dumping a lot of toxicants into the air by burning coal. In addition to that, not known at the time that the Clean Air Act was written, is it contributes significant amounts of carbon dioxide and other greenhouse gases. And this leads to global warming, which is the driver of climate change, and I'll talk about that in a minute. Just at the Healthcare Climate Forum last week or a few weeks ago in San Francisco, one of the speakers, Christiana Figueros, made the statement that if we just dealt with air pollution, we would solve our climate problems. And this kind of information about the impacts of burning the fuels themselves, regardless of climate change, supports her point. We also have other fossil fuels that we pay attention to, including natural gas. So the burning of natural gas as a fuel source is less polluting than either burning coal or running cars on gasoline or diesel. However, there are other, it does contribute to global warming, but less so. However, there are other problems with the extraction of natural gas, and this is basically from hydraulic fracturing, known as fracking. And there are a number of environmental issues that arise from that, from methane production, particulate matter, water toxicity. We could also say disruption of landscapes and communities, etc. And these have known health effects as well, also listed on the slide through the neurological system and others. And then to look at gasoline and diesel. So it's been recently that transportation sector has surpassed buildings as the primary contributor to global warming out of the US. We've done a lot of work on our buildings, is what that means. And also we have shifted largely, or not largely, but significantly to natural gas. But we're still burning gasoline and diesel in most of our cars and buses and trains and planes. And this creates other issues from the burning of it, nitrogen oxides, particulate matter again, and others. And we know that. We know about pollution from cars linked to all sorts of health outcomes, including recently studied Alzheimer's disease and other dementias. But also the significant impacts of CO2 and greenhouse gases contributing to global warming. So that's a little bit of our background as to why we have this problem that takes us to climate change. So these all contribute, as I mentioned, to global warming, but it's really this heating up of the atmosphere that drives all of the incidences that come with climate change. Some of that is heat, but some of it is cold. So it's all over the board. I hope that everyone listening has seen this image. This is from the CDC, Centers for Disease Control, from 2011. So it's been around a while. It continues to be an excellent graphic, both for understanding the health impacts of climate change and also for teaching others about the health impacts of climate change. So we're not going to go through this all right now because of time, but I would encourage you all to take a look at this to just start to understand the different sectors of disease and how they're driven by these increasing temperatures, increasing weather events, rising sea levels, and vector diseases, etc. Another framework that I like is from McMichael in 2013, who talks about primary health impacts. Those are really direct impacts from heat and storms. Secondary, and those are changes in the environment, such as ticks moving north, poison ivy having more virulent toxins, etc. Changes to water availability and quality. And then tertiary effects, those are more of the social and mental health impacts, including things that some of us may experience in terms of depression and anxiety, but also civil unrest. We've heard about climate migrants, etc. So the impacts of climate change are extreme and far-reaching, and we're certainly seeing them now. This is not, it is in the future. There's a lot already baked into the cake that is going to develop, but we're already seeing these now. So that is a background, and it is right in the wheelhouse of nurses. Nurses are concerned primarily about health, both from prevention to treatment to recovering, and the well-being and quality of life that's also related. So as mentioned, we're the most trusted voice professionally. We're also the largest healthcare professional group. We are good communicators typically, and we're professionally obligated to work on this, both from a mitigation and an adaptation side, and also from a health education side. So how can we do that? Well, there's all sorts of ways, and we won't have time to go into them all today, but this is just a bit of an overview. At our professional sites, where we work, where nurses work, it could be hospitals, clinics, schools, NGOs, nonprofit orgs, everywhere, we can continue to learn from the mitigation side about the current energy mix that's in use there. We can request, for instance, in our hospitals, are we doing what can be done for energy efficiency, for renewable energies, et cetera? We can help translate back to our organization and leaders what that means for health. When we understand our own energy mix, we can analyze it, we can report back the health impacts. We can also change our practice to reduce our own energy use, and I'm going to talk about that in a minute. We can impact or advocate locally. So a lot of the work right now in our country anyway for climate is happening at a local level, and that gives us a very good platform as nurses to speak. As trusted people who can help interpret health impacts, we can add to the conversation. We can run for office, but that's not always required, but we have some exciting nurse events happening this fall. A lot of us are watching those. And also we can just speak up wherever we are and help translate those health messages. This could be by joining existing efforts such as those listed here. It could be by starting our own efforts, etc. With elected officials, so these are the folks either at the local, state, or federal level, we can communicate regularly. We all know this. We all ask to do it all the time. My advice is make it easy. Get yourself set up so that you have your fillable forms for email on your screen as bookmarks. Whenever you have an issue, you just email all of your elected officials. You can copy and paste and then refine it a little bit. Also, you can put their office phone numbers in your phone so that it's easy. You don't want to have to go think about it, look it up. This is something we need to do on a regular basis. We need to be heard, and we need to be translating sane messages about health and environment. Also, to visit in person, there are always offices in your home community or at least nearby. Or if you go to DC, it's really a great thing to do at least once, but hopefully more than once. And lastly on this list is really with our peers and family and community. This is another place where we continue to be respected. People are always coming to us for health advice. This is health advice. Taking care of our climate is health advice. So this is another opportunity for us to interpret what sometimes seems rather complex. Opportunities. This is a handy guide that is way too much to go into today, but we call this the WHAM grid, and Kara and I and Dr. Shanda Demarest created this to just look at what can we do at work, what can we do at home for both adaptation and mitigation. So these are just lists of ideas that you already know about in terms of conserving energy and making good purchasing decisions, making good food and diet decisions, getting places other than in a single occupancy vehicle. Some of those are some of the individual things you can do. At work, there are other things that you can do together with your shared governance councils, with your leadership teams, working across disciplines with facilities folks and food and nutrition folks. There's an endless amount of things that nurses can do, and nurses are often really good at doing this. And then at home, we have similar ideas for things that you can do to help prepare for the impacts of climate change. That's considered adaptation. And things to prevent the impacts of climate change. That's considered mitigation. And that's really more on the driving down greenhouse gases in your own life. And then similarly, working together, you can do that with your neighbors, your elected officials, your neighborhoods, etc. So the lists are long. You don't have to do them all, and you can do what actually sounds fun and relieving for you. But it's great if we can get involved. I want to mention the Nurses Climate Challenge. This is a product that came out of Healthcare Without Harm and the Alliance of Nurses for Healthy Environments, again, led by Dr. Shanda Demarest. And this is an effort to get nurses out there talking. And we've set the goal of reaching 5,000 healthcare professionals by the end of 2019. So this is a package that's available online for free. And we are asking nurses to go, sign up, register, and then use the tools that are available there to teach others. There are two versions. One is 5 minutes long. It's really easy. And one is about 15 minutes long. And you don't have to be an expert on this. We've provided resources and easy to translate health messages. So this is a great opportunity. Then we ask you to come back in and report how many you've taught so that we can track how many that we are reaching. And one other opportunity that we are also collecting data on, and this is called the CHANT, or the Climate Health and Nursing Tool. And we're developing a tool, it's a survey tool, to measure nurses' awareness and engagement with climate change and health over time. In other words, we will measure it on an annual basis and report how that changes year to year. So we're in the development phase of this, and this you can find on the ANNE, or Alliance of Nurses for Healthy Environments website. Thank you very much for listening.
Thank you, Beth, for that great presentation. So now we're going to shift away from nursing and look at more of what hospitals and healthcare facilities are doing to address climate change and to help support a transition to clean energy. So our second speaker is Shane Dunn. Shane is the head of Memorial Sloan Kettering's Sustainability Department, in which she formulates and implements innovative sustainability projects, programs, and initiatives across the institution focused on reducing the environmental impacts of operations while enhancing the health of patients, staff, and the community. In his tenure at MSK, the institution has received 4 consecutive top 25 environmental excellence awards from Practice Green Health for leadership in healthcare sustainability. Shane, the floor is yours.
Thanks, Kara, and very happy to be a part of this webinar and talk with all the engaged folks online today. So hopping right into it. As Kara had mentioned, we work hard in integrating sustainability into our operations here at Memorial Sloan Kettering. She mentioned our Top 25 Environmental Excellence Award. We also, through the work and collaboration with clinicians and nurses across our institution, received a Greening the OR Leadership Award from Practice Green Health, and were recognized as one of the 60 greenest hospitals in America for our Memorial Hospital flagship facility in New York City, which is a 473 inpatient bed hospital with 28 operating rooms. We have over 15,000 employees across 30-plus sites within a 50 square mile radius of our Memorial Hospital in New York City. And looking forward to talking a little bit today about how we try to drive energy efficiency and some sourcing of clean energy to reduce our carbon impacts, and how nurses can collaborate at your own institutions, similar to what we do. So we did want to set the stage by talking a little bit about MSK and our commitment to the New York City Carbon Challenge. So the New York City Carbon Challenge is a voluntary leadership initiative between the New York City Mayor's Office and leaders in the private, institutional, and nonprofit sectors who have committed to reduce greenhouse gas emissions by 30% or more over 10 years. The timeline we're showing here displays our commitment starting in 2009, when MSK committed to the Carbon Challenge to meet a goal by 2019 to reduce our greenhouse gas emissions 30% from our baseline year of 2007. In 2016, we actually accepted a more aggressive commitment for a 50% reduction by 2025. And good news is in 2017, we showed that we had achieved a 35% reduction in carbon intensity and emissions from our baseline year, meeting our 2019 goal early. And we'll continue to work on some energy efficiency initiatives, which I'll talk about in a sec, and collaborate with the New York City Mayor's Office and resources there to work towards our 50% reduction by 2025. So some ways that we reduce our impacts at the front end is with our extensive energy efficiency led by our facilities management departments and various stakeholders at MSK. I mentioned the 35% reduction in carbon intensity achieved by 2017. Our institution has invested $16.5 million in energy-related system upgrades since 2007, which actually has almost doubled the return in energy and associated cost savings. And some highlights for our commitment to energy efficiency through implemented projects are work that we did to convert lights to LEDs through upgrades, our chiller optimization for our cooling towers, upgrades to building automation systems, HVAC setback controls in our operating rooms, variable frequency drives on our laboratory chemical hood exhaust fans, zone control upgrades for heating, improved comfort in our computer shutdown program. While this may seem outside of, the day-to-day nursing work and the charges associated with nursing practices, these were done, many of these, in collaboration, especially in the clinical environment, with nursing, perioperative staff across our institution. So it's due to kind of that commitment that we have here internally and to some of the leadership that's shown through our facilities, sustainability, and our clinical staff that allows us to drive some of these energy efficient upgrades, which realizes a lot of carbon emissions savings. And then this is kind of a lot to share right here, but maybe you can go back in the slide deck and take a look. We report to the New York City Mayor's Office in climate action plans on an annual basis, and there is this wedge chart that we put forward that shows planned energy conservation measures to meet our 130% goal, which you can see from the wedge chart that we're under in terms of the pounds of CO2 per square foot, and then what we're doing to meet our 50% commitment. And a lot of these opportunities are through operations and maintenance and some behavior changes that can happen and some facilities upgrades. and alterations to our heating systems and HVAC controls. But I don't want to spend too much time on this because we want to talk about the great work that's being done in engagement across our institution. But first, one more kind of setting the stage item. Through leadership in our design and construction department, we actually design all of our new capital expansion, all of our new facilities to a minimum of LEED Silver. LEED is the Leadership in Energy and Environmental Design certification that's put forth by the U.S. Green Building Council. And you can see these three facilities above on top that have met LEED Silver or higher, and the three below that have been built or in progress of being built to those standards to seek out the LEED Gold for 2 and LEED Silver for another facility that's coming online as we expand our footprint in New York City as well as New Jersey, Long Island, and Westchester County. So to talk a little bit about clean energy and some of the barriers that we have here, being in New York City, we do have an uphill battle to climb in order to source clean energy here into our portfolio. But to the credit of our folks, in 2017, MSK purchased 1/3 of our total electricity for Memorial Hospital from low-impact hydroelectric power, which was made available through this New York Power Authority's Recharge New York program for qualifying institutions. But we're always looking to do more. We have a lot of barriers. One top barrier being us being situated in an urban environment, not really providing the opportunity to put solar panels on the roof or have fields where we can have solar arrays or wind power available. Our nonprofit status has an effect on a potential rebate structure, which is a hindrance to taking part in some potential rebate initiatives that are available. But we continue through the leadership of our facilities department to investigate opportunities for sourcing clean energy from regional solar and wind power purchasing agreements, virtual power purchasing agreements, and community solar projects, which we won't go too deep into those, but essentially the structure of those would be MSK essentially offloading some renewable energy that's placed onto the grid from infrastructure that's in place outside of our facilities. We're digging down deeper, and options look like they're tilted towards some potential on-site solar at our regional locations in New Jersey or out in Long Island. We're looking into some solar arrays, potentially in parking lots, or maybe even if some roof space is available in some of our more rural, not so urban facilities. We can look into those options, but we do have, as I mentioned, an uphill battle to climb to source renewable and clean energy, so it really puts a premium on us reducing our energy use through innovative efforts, through upgrades to our existing facilities, and through comprehensive engagement of staff across the institution to reducing their footprint in the day-to-day operations. So talking a little bit about how we collaborate here, we do have a dedicated sustainability department, which all started with an institutional green team committee that was established in 2009 to implement initiatives across MSK aligned with a dedicated environmental mission statement, stating sustainability initiatives at MSK focus on reducing our impact on the environment. We work to reduce our energy use, material consumption, and waste to create a healthy environment for our patients, staff, and community. All things that can be achieved through the great action items that Beth had shared and through the things that are put forth by Annie and the other leading organizations that are collaborating together. So what you're seeing kind of with these green team and these logo word treatments down there is it started with a green team, but it actually evolved to really leverage the staff that we have across the institution that want to drive change. We now have sustainability subcommittees representing a Greening the Operating Room subcommittee, which has a varied number of nurses, peri-op, and clinical staff on it, as well as a GreenReps staff engagement committee, which we'll profile a little bit in a later slide. And we also have a Greening the Laboratory committee for our research and clinical labs to reduce the impacts of those lab spaces. So to talk a little bit about our GreenReps, because they really are rock stars across our institution. The GreenReps are a group of now, I believe, 330 like-minded individuals across MSK that were really concerned about our day-to-day impacts and wanted to do more to collaborate and drive sustainability efforts at MSK. Each one of them are volunteers, and they act as extensions of the institutional green team and sustainability department, and they are instrumental in helping formulate, implement, and advance varied sustainability initiatives across the institution. I have a bunch of them bulleted below here for some top-level items, but to just highlight a few so I'm not reading off of these, I want to talk some about just the energy-efficient behavior changes. We have, as I mentioned, a Greening the OR committee and a number of engaged nurses that have come together with us in sustainability and some other departments that are putting together comprehensive checklists to make sure that all lights are going down at night, that applicable equipment can be shut off at the end of the day so those aren't powered on overnight, that our computers are being shut down with automated schedulers, that screens are being shut down. We work on proper waste segregation, increasing our recycling and diversion of organics to avoid some of the climate impacts with the end-of-life treatment of waste. In particular, some of our regulated medical waste streams have some heavy, intensive impacts at their end of life, so proper waste segregation and ensuring that only the materials that need to go into our sharps waste and our red bag waste and even our chemotherapy waste are placed in there because of those intensive end-of-life treatment processes that are associated and the associated impacts. We have a comprehensive medical supply donations program that does a lot of good through some organizations that we work with. Paper reduction efforts on reducing the amount of paper that we use here locally, avoiding the transportation and delivery of all the paper goods, avoiding the use of printers, the excessive use of toner, the disposal of the paper, really thinking about the holistic life cycle of a lot of these operations and where you can kind of lean out the operations to make it as efficient as possible to ensure the impacts are being reduced. Our nurses help us out a lot with local environmentally preferred purchasing. We're collaborating on a lot of safer chemicals, avoiding chemicals and materials of concerns within medical supplies, reduction of single-use disposables, alternative transportation and utilizing City Bike. In the city here, since we're located a lot of our footprint in New York City, there's a wide range of transit options, trains, buses, things along those lines. A lot of people don't have to drive to work, but there's always more that we can do for promoting alternative transportation and reducing the footprint for our regional facilities out in New Jersey, Long Island, and Westchester County. And staff education is key to continue to engage folks across the institution on what we can do to reduce our day-to-day impacts. And that's really where we wanted to profile some of our nursing champions that act as GreenReps. You'll probably hear it in every slide. Nurses are the most trusted profession, and that really presents an ideal scenario for advancing sustainability, advancing climate solutions, promoting human health, and ensuring that you can do all that you can at work and, of course, at home as well to promote a healthy environment, community, and population. Here at MSK, we have over 30 nurses and nursing staff that lead or sit on dedicated sustainability task forces and committees that actually are focused on their particular units and what they can do on their unit to reduce impacts. So an example of some of those things that I had just mentioned in the previous slide on our wider sustainability efforts, our nurses have taken the initiative to formulate these task forces in alignment with the GreenReps program and our sustainability department to work with the resources that we have here and increase alignment with resources from Practice Green Health, Healthcare Without Harm, Annie, and participate in the Nurses Climate Challenge. and really aggregate all of these learnings, all the things that you can do day to day. And the nurses work within these sustainability task forces or work as dedicated green reps at our facilities in reducing impacts by implementing these into the day-to-day operations. So everything from those energy use behavior practices, comprehensive waste segregation, environmentally preferred purchasing initiatives, and the list goes on and on for the things that we try to drive here day to day. I think Annie has a great little infographic on it, bucketed into the reducing climate change, understanding the human health impacts associated with that, working to reduce some of those impacts and the associated greenhouse gas emissions from operations, safer chemicals. We have a comprehensive program working with our food and nutrition staff to source more local and certified sustainable foods, and we track spends on that. And then everything that I talked about related to how we work to bring our sites online with a LEED certification, so efficiently designed, but then collaborating across the institution on energy efficient upgrades and energy efficient behavior practices day to day, and how that can really drive positive health outcomes. So it was a bit of a 10,000-foot flyover there, but we really wanted to provide just some of the ways that we work to collaborate as an institution here, from everything with our work with the New York City Mayor's Office and leadership from varied departments across Memorial Sloan Kettering. So it comes all the way from the top, all the way to all of our day-to-day staff that are working here, and really trying to integrate sustainability as a culture here at MSK. So I couldn't be more happy or proud of the work that the folks do here day to day within our GreenReps and within our varied sustainability committees. And the nurses are just doing more and more as time allows day to day to really collaborate with us here, and their voice really holds a lot of weight at our healthcare institutions. So it's been wonderful, the collaboration that we've been able to see so far, and we look forward to working further with Annie and the associated organizations that are speaking today. And thank you again for the time, and look forward to further collaboration moving forward.
Thank you so much, Shane. And then I'll turn it over to our final speaker. We're going to kind of take a little bit of a shift from the health sector to more of a science-based organization, but we're going to hear about a lot of the amazing work that the American Geophysical Union is doing with their Washington, D.C. headquarters. So to introduce our last speaker, Elizabeth Landau is the Assistant Director of Public Affairs at the American Geophysical Union in Washington, D.C. She has spent over a decade of her career dedicated to bringing together Earth and space scientists and policymakers. Through targeted relationship building, she works to enable collaboration and problem solving at local to national scale. She has overseen the creation of AGU's Voices for Science program and numerous other events and programs to bring together policymakers and scientists. And with that, I'll turn it over to you, Liz.
Great. Thank you so much. I really appreciate you having me today. I enjoyed what Beth and Shane had to say, and I'm excited to share my story as well. So I'm going to talk about how AGU is renovating its headquarters to be the first net zero energy commercial building in DC. Net zero meaning that we're going to make at least as much energy as we use in our building. I have a lot to share, so I'm going to try to move through everything really quickly. The quick overview of our scope here, AGU is going to be in the top 4 to 5% of LEED projects in the world. Shane had defined LEED earlier. And we're looking to achieve a 95% reduction in our lifetime carbon dioxide emissions. We hope that someday this is going to be the norm for buildings, but for now, we're happy to take this on and be sort of that cutting edge technology that helps make this more feasible for other organizations in the future. A little bit about me. As you heard, I work in government relations day to day. I'm also the chair of the Building Ambassador Committee. So I'm on site at our construction site weekly. I'm working with our building team as well as all of our staff back at AGU to ensure that we have communications between the groups. So while I may not know the technical side of some of these amazing new technologies we're using, I'm definitely well versed in this. So let's talk a little bit about why AGU is doing this. Our organization has over 60,000 Earth and space scientist members worldwide, and most of the scientists who study climate change are our members. And because of this, we have really strong position statements on climate, and we have the vision that you see here, which is to ensure a sustainable future. Our centennial is also coming up in 2019. So there's an additional legacy aspect of this, which creates incentive to take on a major project. In addition, we have a relatively new GeoHealth journal, a new open access journal that has research articles about the intersection between the earth and environmental sciences. So this is a new direction that we're taking as well. All of these come together to spur us on to try this new project. These are some of our building goals. We're looking to build a healthy environment for our staff, to showcase earth and space science contributions of our membership, and to push the limits of building performance related to energy. So a little bit about the current versus the future building. We started with a building that was built in 1998 by AGU for the staff. We have over 100 AGU staff at this point, and we also had a couple of small organizations who rented office space from us. We are reusing over 96% of the existing building and building materials. So we are keeping a large part of the facade. A lot of that is to help keep our carbon footprint down. It's kind of a funny shaped site. There isn't a really big footprint for solar, as you can see from this plan here. And we're also right on the edge of a historic district. So this meant that we can't produce all of the energy that we're going to need through solar panels on the roof. So we had to find additional ways to get around that. And we also had slightly stricter zoning and had to get more approvals and workarounds for our building. So how are we doing this? We have a few technologies and strategies and some firsts that we're accomplishing, at least in DC. And in order to meet these goals, we had to think about 4 general categories: generation, reclamation, absorption, and reduction. And through the 4 of these, we were able to find different ways to actually meet that net zero goal. So this is a big list of the technology that we're looking at. I'm just going to go through a couple of these. But generation includes things like solar panels. Reclamation is things like stormwater collection and sewer heat transfer, which I'll talk about later. Absorption is recycled water flushing and our hi-fi wall, which I'll talk more about. And then reduction is lower energy and water use everything, all kinds of plumbing fixtures and lights that tend to use less electricity and water. So I'm just going to talk about a couple of these items. One of the most exciting ones is our sewer heat exchange system. If you're familiar with geothermal heat, it's the same idea, but it's perfect for an urban setting because the heat actually comes from a sewer. So when the water comes in from the sewer, it goes through a heat exchanger, which cools or heats clean water inside the building using the energy from the warm sewer water. And then that clean energy is used to heat or cool the building. This has been done in Germany, but it's never been done in the US before. So this is the first model in the US. We wound up digging into the 150-year-old brick sewer next to our building. You can see a small photo of that here. So huge thanks to any of you who live in DC and are helping us keep our building nice and comfortable. One of the other things we have going is our radiant ceiling cooling system. This uses circulated chilled water that goes through a network of pipes in our ceiling. You can see an image of this in the lower left of the screen. And this is a lot more comfortable and more efficient than forced air. So it's helping out our energy use and keeping our staff comfortable inside the building. One of the other really cool bits of technology is we're going to have a photovoltaic array, also known as solar panels, on our roof. And we're using DC power. So we typically use AC power or alternating current because it travels long distances really well. But many of our devices that we use, including our computers, LED lights, all use DC power or direct current power. But the PV array that's going to be on our roof generates direct current power, and we only need it to travel inside our building. So we're using a fully DC system from the generation to the use. This is actually really new technology, and not having to convert the electricity back and forth is about a 20% energy savings. So that's a big component for us. The next item I wanted to touch on was water capture and reuse. We're going to be collecting rainwater from our roof, and then we're going to filter, chemically treat it, and condition the water right on site. This will enable us to produce all the water that we need for flushing our toilets and irrigating right on site, so we don't have to use that fresh, clean water for those things. I mentioned this earlier. This is the hi-fi wall, or the hydroponic phytoremediation wall. It's a multi-story open space within our building which has living plants in it. The roots are actually in water rather than soil, which makes them about 200 to 300 times more effective at cleaning the air that is circulating through them. The air naturally moves through the root system and is cleaned in the process. So we won't actually have to force air around the building and through filters to clean it. That can take up about 30% of a building's energy use, so it's a huge savings for us. And of course, this has wellness aspects as well, having living plants right inside the building. So I'm going to switch gears and talk a little bit about the information and communication aspects of our remodel. We're doing a lot of data capture and sharing. We're tracking data on everything, down to the energy use at each individual workstation. And all this data is going to be openly available online. So we hope that we can learn, improve, and share this with others as we go. Our scientist members are really excited to analyze this data, and any of you are welcome to go ahead and check it out if it's useful to you as well. You'll see our website a little bit later on where we have the information on where to get that. We're going to be hosting tours of the technology that we're using, and we are also going to have an exhibit space on the ground floor to talk about our member sciences. So we'll take people through the building to look at some of the mechanical systems in the lower levels and on the roof, so they can see how they can have these kind of technologies as well. This is the website I mentioned before. This is building.agu.org. And this is where we're putting out a lot of our communications right now. Construction updates, keeping in touch with our neighbors, and growing excitement about the building in general, which is a good segue to the people side of things. The wellness for the people working in the building is really important for us and was kept into consideration the whole time we were working on this. As I mentioned, there's the hi-fi wall, which is helping to clean the air. We also have a large open stairwell, which you can see in the left-hand photo here, which helps with air circulation, gives exercise to staff being able to walk up and down this stairwell rather than taking the elevator, and provides natural light. The open concept also adds to additional natural light throughout the building. We're not using any forced air system, which is more comfortable for people who are inside. And we have a nice new rooftop space up there where we can work outdoors as well. We have new showers in the building to encourage biking to work, and we're going to have a gym with all self-powered equipment. So it won't use electricity, but people can get a good workout during the day. And then lastly, I want to talk about the challenges that we've had to overcome for this. The first one is buy-in from our board of directors. For us, we had come to the end of life for a lot of our HVAC systems, our elevators, and other building systems. So we essentially gave our board the option: we can either replace these or we can improve them and live our vision. So for us, it's about having a financially stable starting location and then being able to embody our vision as we celebrate our centennial. We had a very inclusive brainstorming session early on with stakeholders to find priorities and get buy-in. And so if any of you are thinking about doing something like a major renovation and you need to convince your board or other stakeholders, some things to think about are leveraging an event or milestone, showing how valuable it is to members, staff, or clients, emphasizing living your vision, and getting buy-in from those key people. We also had to deal with permitting and building design within a historic area, which meant we had to do a lot of communication with our external stakeholders. There were lots of meetings with local boards, councils, ANCs to get everyone on board, and we had to go back and forth a bit to get approvals for our final design. But we kept pushing, and we were able to find something that worked for everyone. Our final challenge was to get buy-in from staff and ensure that their daily actions make the building work as we intended. So this is an ongoing challenge as we begin to move back into the building. There's lots of communication going on with the staff right now. We're collecting concerns, feedback, and addressing all of those. We're teaching our staff best practices for living in this building and providing ongoing support because the behaviors are really going to make or break reaching our goal. So closing up here, the road ahead, we move in this fall and we have to learn to adapt to our new building. We'll see what the data says and we'll make sure that we're conscious of our energy use. So thank you all so much for the time and look forward to your questions.
Thank you, Liz. What a great example of an organization that, like you said, is living your vision. So real quickly, thank you to all our speakers on the webinar today. It's been some really great presentations. Just a reminder, if you'd like to enter a question, please remember to enter it in the chat box at the bottom left-hand corner of your screen, and we'll get to them in just a minute. In closing, I want to turn it over to Rebecca Rear, who's Rebecca is the program manager for Climate for Health, and she's gonna talk about an exciting new initiative to help support health organizations in their efforts to move towards 100% clean energy. So, Rebecca.
Thank you so much to all of our wonderful speakers. It's truly an honor to be batting cleanup here after an incredible afternoon of presentations. As you can see, there are a number of initiatives across the health sector and the scientific community more broadly, where individuals and institutions are stepping up to mitigate their own carbon footprint as part of their missions to improve human health. In May, Climate for Health convened a national forum to discuss the ways the health sector can lead on climate action advocacy. What you see here are the 4 key takeaways from the forum. The full forum summary is available on our website, and we're happy to circulate the link with the presentation. Health professionals are eager to be leaders in this space, and we are helping to support them in taking the necessary steps, which leads us to our work on 100% clean energy. One critical step to do all of the great work and to mitigate our own carbon footprint is to move towards 100% clean energy as soon as possible. We know, and Beth explained earlier, the harms fossil fuels are having on the climate and on our health. So we are helping identify pathways with each partner to adopt commitments. Beth also spoke earlier about nurses as advocates and health professionals as advocates. Well, when you're mitigating your own climate impact and you're walking the talk, it only strengthens your advocacy. And as Liz mentioned, we're hoping one day that a building like AGU's will be the norm. But until then, we hope to increase our advocacy on this work and influence cultural norms on solutions. We're also, in order to do this, we're hoping by creating new resources, including a roadmap for 100% clean energy. 100% clean energy may sound like an ambitious goal, but you can do things now to help you get there. You can start today by assessing your electricity bill. Figure out where you get your energy and how you're using it. This roadmap is meant to help you start this process by breaking it down step by step, and we're here with Annie to help. I think all of our speakers today illustrated the ways they're implementing some of these steps themselves and the particular ways that energy efficiency and conservation are important first steps on the road to 100% clean energy. In the coming months, Eco-America and Climate for Health are working on a number of additional resources to support our partners on this work. Thank you again for your time and attention, and I'll hand it back over to Kara to facilitate the Q&A portion of the webinar.
Great, thank you, Rebecca, for that great close. So we have some questions in the chat box. The first one is for Beth, and I know that she had answered it in the chat, but for those who are on the phone, I'm just going to have her delve a little bit deeper into the answer. So the question is, can the chant tool be adapted for public health professionals? And maybe, Beth, you can explain a little bit about why we started with nurses and the potential for expanding on that.
You bet. Thank you. And thanks for the question, Rose. We started with nurses largely because of what we've said today, where nurses are the largest single professional body. It is right in our wheelhouse for an area of concern. And from what we have learned anecdotally and otherwise, not all nurses have thought about this, know that much about it, have made the connection between climate and health. And more schools are adding some in the curriculum, but it is a minority. We don't even know how many, but I've heard people say, I guessed once 20%, and people said, that's high. So it's not throughout our profession by any means. So we thought, let's figure out how far through our profession it is. So it's based on, as mentioned, awareness, motivation, concern, behavior, and what they're seeing in terms of symptoms. So we have had it out for a few months, and we're collecting the first round of responses, which we now have. And so we're doing the first phase of psychometric analysis, and then we will refine it probably and test again, and then we will measure again. So it won't be ready for repeated use for a little bit, but we're in the process and think this is an important contribution to be able to watch changes in this way over time. Rose asked if we were able, or someone was able to adapt it for public health professionals, and I think so for sure. I mean, many of the questions would be appropriate for any clinical or health-based team. There are some that are a little bit specific to nursing, but I think that would certainly be doable. I think once we have the validation and reliability statistics, it will be you can justify using it a little bit more cleanly. And then Rose also followed up with just the statement that it would be good to develop to work on this, adapt this for developing countries. And I think there's real potential there as well. We hope that it will be a usable, repeatable tool. So thank you.
Great. Thanks, Beth. One of the other questions was just a little logistical question about will we be sharing the slides, and just to let you know, we will share the webinar recording, which you'll be able to see the slides in that, but then we can also try to share a PDF version as well, so you'll all have access to that information. The second question is for all three of our presenters, and maybe we'll start with Shane and then Liz, and then if Beth wants to chime in. But what tools are being used to calculate emissions reductions of the energy savings?
Yeah, so I can start with that. There are actually resources that are provided to us by the New York City Mayor's Office and that have been vetted by a few through the Energy Star Portfolio Manager and some templates that are associated with the New York City Carbon Challenge. Some of those resources are publicly available, and we can help tie Kara, you and some of the folks in with some of those web pages, but essentially the Energy Star Portfolio Manager and some of the associated tools for carbon inventory help us place some of our energy use with the different fuel sources and categorize that into the associated greenhouse gas emissions, and that's used for our impacts as well as our projected reductions moving forward. I know the EPA has a greenhouse gas equivalency calculator, and there's a number of other EPA resources related to the WARM model and so on and so forth, but I'm sure some other folks on this webinar could speak more to that than I can.
Liz, did you have anything additional to add, Liz or Beth?
This is Liz. I do not have the name of the tool that we're using to track, but I've put in a request already with our building team to get that information, and I can share that with the organizers here who can get it out to everyone.
And this is Beth. I would say that for scope, so I work in a 50 hospital system, and we look at greenhouse gas emissions for these hospitals. And many of us, but not all, do report to Practice Green Health, and they have a greenhouse gas report, basically based on a variety of inputs. What we have focused on, because it's a lot easier, is scope 1 and 2. And for that, we basically use a conversion factor based off the EPA grids for energy mix. and calculate it that way. We've gone further to do a space-adjusted EUI and greenhouse gas related emissions on a square foot basis, which help give us some idea of how to compare ourselves to each other. But generally speaking, for scope 1 and 2 anyway, it is closely tied with your energy use. So it's an easy conversion once you have your energy use figures. Thanks.
Great, thank you, Beth. And then another question we have is, have you looked at the cattle industry as a major contributor to climate change? And I know, Shane, you mentioned in your presentation a little bit about some of the food and agriculture initiatives that you're doing. So I'm wondering if you have anything to share about meat reduction programs that MSK is doing. And I know Beth might have some answers to chime in as well.
Yeah, absolutely. So we do have a comprehensive program with our food and nutrition team. We report upon our meat purchased per pound annually, and we track spends with all of our vendors and categorize that into various categories related to different types of meat. And these are in alignment with some commitments that we have to reduce the amount of meat purchased at our facilities. And due to the climate-intensive impacts from the meat and cattle industry, we've worked to integrate Meatless Mondays into our cafeteria and into our food service operations. Our food and nutrition team has taken on a lot of work to create various recipes that really leverage a lot of delicious ethnic recipes in terms of we have a Taste of India station, Mediterranean station, a lot of different things that are done at our facilities, as well as a blended burger, which uses half mushrooms in place of meat, and Beyond Burger, and which is sometimes, I think, known as the Impossible Burger, which is a meat substitute. So we take a lot of different measures through food preparation and through tracking our purchasing of foods from different vendors to, in alignment with the Healthier Hospital Initiative, which is a Practice Green Health program, reduce our meat spend year over year and have a lot more plant-based options on our menu. And it's been successful thus far.
This is Beth. I would echo that. In our health system, similar approaches, not necessarily absolutely everywhere, but blended meats, local meats, fewer meats. We had tried in our own hospital a meatless day, such as Monday, but we did get pushback because not everyone wants to have no choice. So what we've done instead is really lean on the other choices. So we make sure we always have vegetarian options and we always have vegan options for our meals. And there are meat options. But in that process, we have seen the numbers, and this is total pounds of meat and also, normalized by the number of meals. So it's a percentage more or less. We have seen that go down over the years. But I think there's always more to be done, and especially about connecting the dots. I think the questioner was asking about, do we explain why that's important? And we do, but I don't think we do it enough. And so I think that's a good reminder. And then it reminded me to ask you, Kara, if Annie has addressed that, at least from the knowledge side, to really connect those dots about our meat industry and climate change.
Yeah, and I'll just chime in real quick. I know we have many nurses who are interested in meat reduction and food sustainability, and many of the initiatives that we kind of promote include those that Shane and Beth mentioned, in doing Meatless Monday and reducing meat served in the cafeteria to have smaller portions and do more produce and so that you have not only, people eating a healthier diet, but you're also reducing the meat that you're serving and reducing the greenhouse gas emissions. And we also are part of a food and climate coalition that really looks closely at some of how different organizations can work together to promote more of a plant-based diet, and how we can transition away from a really heavy meat diet that has significant implications for not only just environment, but the climate overall. And I'm just we have another question here, and this looks like it would probably be good for all of you. Maybe we'll have Liz chime in first because this seems to be her area of interest that she works in. So I'm a nurse and I work in the air quality and educating the public on emissions and air quality and the health effects. My question is, do you find resistance when educating the public or with political leaders, and how do you overcome any resistance and fears the public may have?
That's a great question. And yeah, I spend a lot of my time essentially talking to policymakers about climate change. And so I definitely have experience in this area. For us, the most important thing is to find common ground to start with. Talk about the local aspects, local impacts, whether it's, health issues or something else that's happening locally. But if you can find those local impacts before you even start to talk about climate change and begin with that common ground where you can agree with the political leaders or the public, and they can understand that you're coming from a place of being interested in them and their community and wanting to help them. And then you can start talking about climate change and things that you can do to kind of help mitigate that. I think that has been the most effective method for us.
Great, thanks, Liz. And does Shane or Beth want to chime in with some strategies that have worked for you all?
This is Beth. I'll say something and be brief. I remember 10 years ago was the first time we asked people in our hospital to say what would they do about reducing greenhouse gases. And we got some pushback, not a ton, but we got things like, I'm not doing anything because that's not real. 5 years ago, we hosted a climate and health 4-day event and brought in about 500 people from our community over those days. And people were hungry for this information. So in between the 10 and 5 years, I think things settled out a little more. And from then to now, I really don't get much pushback with the public or colleagues that I speak with. That could be where I am, located across the country. But that doesn't mean that that's the case with our elected officials, because I am in a red state. But one thing I was going to say in terms of people's fears, which I think was brought up in the chat, was I think it's important to validate those fears. This is scary. We're at a point in time when we have a lot at stake, and it's important to help, I think, ourselves and others identify what it is that they value that causes this fear. And that's a great motivator. And it doesn't have to be intimidating or, terribly daunting even, but it really can help motivate people. So I think to talk with people in a sensible way that's based in science and that's in, through the caring voice of a nurse and based on what we know about health can be just really powerful. Thanks.
Yeah,
Thanks,
this is Shane. I can echo what both Beth and Liz had mentioned, and really the approach that we take is tying it and really setting the stage and the case for tying it to the health benefits and the negative health impacts that can come along with climate change and an increase in, greenhouse gas emissions, and tying that to the, the mission of healthcare, the credo of do no harm, and our mission here at Memorial Sloan Kettering, and positive. Everything goes towards our positive patient outcomes. So that's really the key, and tying it to the health impacts and the potential health benefits of mitigating some of those impacts are really where we almost start and finish with a lot of that.
I have another question here that we can open up to the full panel, and I think it's a really important question, so I'm glad that someone asked it. Has anyone calculated the health benefits per unit of emissions reductions, and is there a formula or model for the health benefits and or the healthcare costs?
This is Beth. I'll just point out the health. Let's see, the Energy Health Calculator, I think it's called, Health Energy Calculator from Healthcare Without Harm. And that is a limited calculation based on just the utility-based energy. So you plug in square footage and you plug in, what grid you're from. And that does give an account of greenhouse gases, direct illness, indirect illness, cost of illness, etc., including some of the common diseases and symptoms, and they'll list that out in percentages and raw numbers. I think that's helpful, and yet I want more. I have been on a few calls this year that working with Healthcare Without Harm and others who are trying to develop a more refined tool. In my work in the healthcare system, I feel like that's a crucial piece that we don't have easily enough, because we always need to translate this back to why this matters, and health outcomes are very important. So I'm with you. We need more and better.
Excellent. Thanks, Beth. And I'll just close with one last question, and this is directed at Shane. Work at MSK is truly inspiring. Not all facilities and communities have the same support from state and local elected officials. Sometimes communication and policy barriers among public, private, and nonprofit organization sectors get in the way. In many cases, we need to demonstrate return on investment, benefits to the bottom line, monetary advantages to shareholders who may be climate skeptics. I am interested in hearing about the cost benefits of addressing the aspirations articulated in MSK's environmental mission statement.
Thanks for that question. So here in the sustainability department and through the efforts across MSK that we work on, it's articulated that it's not only environmental impacts that we're avoiding, we're also rooted in cost savings and driving efficiencies and positive staff recognition, and taking some of the examples that I mentioned within the energy efficiency. Reducing your energy use is directly related to reducing your utility bills, which goes against the bottom line of your organization. So depending on which stakeholder you're engaging internally or even externally, that's a good business case to associate with something like energy savings and potential investments. Of course, everything that we do needs to come with a comprehensive project or program plan, a return on investment, and things that will really provide value to the institution. But for most all of our sustainability actions, the energy efficiency is an easy one for cost savings. It's kind of a no-brainer from the business sense. And even with our waste management, as many hospitals and health systems will attest to, when you look at the more regulated medical waste streams or even trash versus recycling, you usually sometimes in contracted structures, you have to pay either per pound or a volume-based fee to dispose of your waste. So the more that you can divert into less expensive waste streams, if one of those happens to be recycling or away from regulated medical waste and ones that have a more positive end of life, then you'll be assessing and incurring less costs for your institution. So there, in ways that the sustainability initiatives work in reducing the resources used, that often comes with hard cost savings for the resource expenditures that are associated there. So there's a lot of work that we do internally here, and communication on the value adds of sustainability, and put those into hard dollars and cents when we can. So I know I just kind of did a top-level flyover there, but always willing to talk to other folks at different hospitals and health systems about successes we've had and ways we've been able to achieve it. We feel that sharing best practices amongst our peers are really a way that we can, collaborate as a healthcare as a whole, and we leverage successes from other peers. Peers do the same with us in a number of cohorts, roundtables, practice green health, healthcare without harm, have great forums for these types of things. So,
great, thank you so much, Shane. I think that really brings attention to the importance of partnerships and how we really need to work together, because this is some big challenges we're facing, but seeing all the positivity that's coming from what groups are already doing. So I want to give a lot of Final thanks to all the speakers, and then thank you to all who joined the webinar. And please look out for a follow-up email with the recording and links to the evaluation for continuing education. Thank you.